See, it's a common sense kind of a thing that a stage 1 breast cancer or a lung cancer will have a far better cure rate as compared to a stage 3 or stage 4.
Correct.
And there's a presumption that if you don't undergo a regular kind of a checkup, then you're more likely to be landing up with an advanced kind of a disease.
Yes. Hi, I'm Rashi Saraogi. I have founded this healthcare company called Healync, which helps patients connect with the best medical care around the world. Healync is bringing this series which will help you get clarity in decision making in managing your healthcare and treatments. Complex cases like cancer brings with itself a lot of stress and anxieties and uncertainties. This episode will focus on how to access the best care to fit your medical requirements and case. Our first guest speaker today is Dr. Ramakant Deshpande. He is a lung cancer surgeon and is extremely distinguished in his field. He has also received the Padma Shri Civilian Award for his contribution to the field of medicine for the last 3 decades or more. He has gone from being a surgeon to establishing cancer centers in our country, and we have the opportunity to discuss with him the myths, the misnomers and the misunderstandings related to medicine, especially cancer, where people take hasty and wrong decisions all the time. And my first question to you, sir, is that what keeps you going still?
You know, when I really started my career about 30 plus years back, only about 30% of cancers could be actually cured. 70% had to be just, it was just a prolongation of life. Today the thing is coming to almost a reversal of that. We are probably never going to see a 100% cure of cancer, but I think a lot can be done today to prolong the life, improve the quality and make them feel better. So there's a lot more to do, and the more you go, the more you identify that you are not really done. This is really so much you would like to do more, and that's what keeps me going.
That's fantastic. But what, like in your experience, what has been this one big fear with cancer? Why are people so afraid of it?
See, it is not the death that is the topmost in the minds of people when they suffer from any problem. Any sickness will unsettle you because you're in a situation about which you understand not too much and you can handle very little. And most of the people, even today, are not really covered by insurance. Somebody is absolutely all right, he goes to the doctor and comes back with a diagnosis of a stage 4 malignancy, where you actually land up telling the person that, well, you're absolutely fit, you're in your mid-50s, but your anticipated life expectancy is only a couple of years. And how do you really come to terms with it?
How do you tackle that?
And then what happens is these kind of things actually become news and they spread outside. People will not remember good things, but they will always remember those bad, odd kind of a thing. That if you get a phone call that, okay, there is so-and-so has got an accident, what comes to your mind first? The worst.
People have access to information today.
Yes.
Through Google, through talks, through so many other sources. And sometimes there's a lot of information that they're trying to collate. Is that something that you also see a pattern or behavior in patients who just like to go and talk to as many people as they can? Is that a good thing or a bad thing?
Gaining knowledge about a situation is always a good thing. You must understand that. But what happens is, for example, people start Googling the thing. Now, Google is an enabler. It is not a decision maker. So don't allow Google to make a decision. There are trained people for that. This is something which you must fundamentally understand. Your knowledge must come from proper study and assimilation of that particular knowledge.
Yes.
Where will the knowledge come from? It can come from your internet, it can come from the books, it can come audiovisually. You will see a lot of programs on the TV, interaction with people who are probably a little more knowledgeable than you, or even from your doctor.
Correct.
I'm sure everybody in this program will have a few doctors who are their friends.
Yes.
So, always be very curious.
Now, but what happens when there is conflicting opinion? Because that there are patients who are, if they've come and met you first, they are going to walk out of your door and maybe go to another person. And in cancer especially, there are many cases of confusion. There isn't like one method to all, somebody, like if it's an advanced cancer, we know that sometimes a medical oncologist might differ from a surgical oncology, like that's your specialty. So then there are decisions that are very diametrically different given to a patient on a platter, and that perplexes me, that how do you expect that patient now to even come to a decision. They have not studied medicine, but now they've been given two very different logical approaches.
Many times, even in cancer, you have the specialists of radiation oncologists, medical oncologists, surgical oncologists. Actually, they should be working together.
Correct.
There should be no competition among them, but in real life, it can appear like that. So there comes the role of asking sensible questions. What are my chances of cure out of this? There's a certain, are you likely to cure me by doing this particular approach? So that is what is important. For example, now stage 1 breast cancer, small tumor, lady gets a lump in the breast, she goes this thing. Then one person says, no, you have to take first chemotherapy. Surgery, we'll see about it later. Okay. You go to somebody else and says, no, you have to be operated maybe within a week or so. Again, conflicting opinions.
Exactly.
There's a reason for it. You do a further investigation. There's hormonal receptors. If all the hormonal receptors are negative, these patients benefit by preoperative chemotherapy.
Okay.
So there will be a decision coming from knowledge.
Okay, but this should be known to both the medical oncologist and the surgical oncologist, right?
Yes.
I mean that you have to do further investigations to come to a
Correct.
decision, and
Correct.
yet sometimes there
Correct.
are these conflicting opinions. But like you mentioned, that there are pertinent questions to be asked to your doctors as well. That what is my chance of cure? What is my chance of early cure maybe, or if there isn't a chance of cure, then what should be the relevant question?
No, it is not that. See, ultimately there are 2-3 different ways of reaching the same kind of a result. For example, there used to be a time when surgery used to be the only line of treatment for rectal cancer.
Okay.
Now there is a large lump under this thing, so you actually pass stools from your blood from your stools, and then you resect that particular area and then operate, which is a 4-hour surgery, 14 days admission, 2 months of recovery, and all that kind of thing. Over a period of time, now we find that you can actually give chemotherapy and radiation therapy, and the disease remains controlled in 75% of patients. In about 25 to 30%, it will come back. It may not come back only there, it can come back in the form of a spread. It can go into stage 4. So, if you go to a radiation oncologist and a medical oncologist, they'll say that, okay, we'll try this particular thing. If it comes back, we will see surgery about that time. Surgeon will say that, no, I think let's operate. So, this is going to be a conflict, what you are referring to.
Correct.
So, but if they sit together, you'll always get a correct.
We should encourage people to when there are conflicting opinions, that if they could request their team to sit on a joint call, or maybe share the opinion of the other specialist also with the other.
In oncology, by and large, most of the opinions which come from a joint modality.
Okay.
A combined modality clinic would be there. Most hospitals have that. And otherwise, if you find as an individual surgeon and all that, you could always ask them to sit together and then evolve kind of a consensus.
Okay. So interestingly, sir, you have spoken about the fact that doctors are open to second opinions. They don't mind, and if there are any confusing arguments or decisions being given to a patient, they should go back and request for a team opinion, which is great. But a lot of, like you mentioned, high profile people who are in high profile, like in a very, very demanding profession, or their time is extremely limited, or for privacy concerns, there are people who like to travel internationally. Sometimes because of this confused opinion thing, sometimes that we don't get it from a team, they like to think that there are more authoritative institutions outside of India where they like to submit their case and get an opinion. How does our faculty in India respond to that, and are they open to it? Is that something that we encourage at times, and when do you encourage it?
It has always been there. It's not that it is happening today. It always happened right from before Tata Memorial Hospital came, Lady Tata went actually to England and the US, so for opinions and for treatment, because there was nothing available here. Now, what makes for a result is a good combination of all specialties and infrastructure that hangs together to deliver a particular desired result.
Correct.
Okay, result in the form of primary treatment, rehabilitation, psychologically, and the overall ambience also you want to do
Right,
that.
right.
For example, some people would like to go to a 5-star hotel to have a breakfast. So other people may be quite comfortable, going to
Enjoying
a
the street
roadside
food,
stall,
yeah.
and they may enjoy it as much, So it is the same kind of a thing the thing.
So
Does it really make a qualitative difference going abroad or this thing? In many cases it does. There are rare diseases, particularly hematogenous diseases or things which need very, very large resections or very minute kind of treatment where people specialize. For example, there is a acoustic neuroma, which is it's a tumor which occurs to the hearing nerve and it occurs within the bone. Now, there are centers in Germany or some other places where people specialize only in that.
Okay.
The man will have done all his life only that particular type of treatment. Obviously, that nerve actually intercrosses two other nerves, facial nerve and all that. You do it a little differently, you will have a paralysis of the face and all that kind of a
So
thing.
they're very high risk procedures.
Yeah, very high risk procedure, not to life,
Right.
but
to
to side
quality
effect
of
for
life,
this
yeah.
thing. So if you choose, there is definitely a cost difference. It may cost you maybe about 5 or 10 lakhs here. It will cost you maybe 50 or 60 lakhs there. But your chance that you will come back with a very, very sound kind of a result without any collateral damage is going to be extremely high. So when you have a situation like that, and mind you, all situations are not like that.
Right.
Most of them, 95 to 98% situations are not that. If you ask me how do we stand or compare to the services
world, yeah.
to the world, I would say that we are almost 95% there. So I would not like to say that हम उनसे बेहतर है, but हम किसी से कम नहीं है. Then second opinion, this thing, you don't have to really go today with the kind of communication what we have. You can actually have a nicely digitally converted kind of a report. There are agencies which specialize in this and should actually go to those agencies. Very few people really specialize in that. Get that particular thing and then send. There are agencies again which collateral that we're having a second opinion from abroad.
And there is this increasing energy around early detection of cancers.
Yes.
As you know, we have always heard from you and colleagues that the earlier the cancer is detected, the better the outcomes, the better the
By and
results.
large, yes. See, it's a common sense kind of a thing that a stage 1 breast cancer or a lung cancer will have a far better cure rate as compared to a stage 3 or stage 4.
Correct.
And there's a presumption that if you don't undergo a regular kind of a checkup, then you are more likely to be landing up with an advanced kind of a disease.
Yes. What's your thought on these multi-cancer early detection blood samples?
Now what you're saying is the sensitivity of a test will be very high,
Yeah.
which means that whether there's abnormality or in some cases no abnormality, those tests may come out to be positive, and then you're set out on a wild goose chase.
Yeah.
Yes, so that it does happen that way, and that's why we don't really use these biological tests for cancer detection. Okay. Now we have certain panels and all that, like doing a PSA. A PSA which is higher than 6 or 8 would indicate that there's something wrong with your prostate. Yeah. Not necessarily cancer, but please look into your prostate. So similarly, a mammogram which appears to be abnormal is an indication for undertaking further investigation towards cancer. CT scan of the chest, a low dose CT scan, what we call it as, if it shows a nodule which is more than 8 millimeters in size, it does indicate that yes, you must establish a diagnosis for this if the nodule remains for more than 3 or 6 months, or if it starts increasing. So, but even 8 millimeter or a 1 centimeter nodule is still in stage 1.
Correct.
With a 95% cure rate. So what happens is you put a given population, you can't do that entire 140 crores, you can't do it cost-wise, it is not effective, it's not logistically feasible. But there is a high-risk population between 55 and 75, people who have been smokers for more than 20 packets a month, and who have been exposed to, suppose industrial pollution is there and so on and so forth is there, but practically it means that if you are from a big city, you qualify to be a high risk.
Because of the environmental reasons?
You could be from Calcutta, you could be from Mumbai, whatever. So because the pollution is very high.
Okay.
So when we do this, it's better to have a regular checkup, a yearly checkup with certain. There are definite, defined kind of investigations. Your chance of getting diagnosed into a problem is definitely higher. So there are two things about this. One is, yes, diagnosis is better. Second is, they get worried. What if I get a problem?
Yeah.
Would you like to be treated, if at all you are going to have a problem, would you like to be treated in an early stage or in a late stage?
Correct.
That is what is going to decide about.
And that is the question that we need to ask, that cancer may happen at any stage of our lives, but early detections give us the chance to a cure, to a life with dignity, and we are just giving ourselves a better opportunity to come out of it with less disabilities and less deformities, and a chance to win this battle. I'm still sure that if the word cancer is told to a person, it'll just still shock them. So if it happens, if a person is said that, okay, you have cancer, how would you emotionally counsel that person, and what should be the next steps?
If the decision comes from knowledge, it's always more satisfying and more peaceful. If somebody is told today that what will you, suppose you have got cancer, what will you do? First and foremost, realize that cancer is curable, particularly in early stage. Even in advanced stages, a lot can be done today. Prolongation of life very comfortably and adding to the quality of life. Today the suffering which was perceived because of chemotherapy, because of surgery, etc. is not really much at all. Everybody thought that chemotherapy will cause a lot of vomiting, pain and all that. It doesn't happen. Those days are 30 years back, days are gone today. So I think that is something which we must realize. Number two is interact with your doctor. And good doctors are available practically within 100 kilometers everywhere in the country too. So this is second part of it. Facilities are very, very good. If you feel that if the doctor feels that the facility is not the same as the best result, then the doctor very likely is going to refer you to another doctor in the same country. Okay, so this is definitely third kind of a thing. Have a support mechanism, which means that your family comes first. You have to take the family into confidence. Your doctor will have told you what is the kind of changes which are going to take place during the treatment or after the treatment. So it's best that you take your family into confidence. You have a little bit of a support group, particularly like an elderly person in the family gets cancer, he's going to be referred for radiation therapy. Husband and wife are working, there's nobody else at home, and that old man or old woman has to go for radiation therapy 30 days. There are support groups today. You put it out in the net and say that my father or my so and so has to travel to the radiation therapy which will take about so much of time. Is there somebody who can actually accompany the person and bring them back?
Oh wow!
You will be surprised. I'm telling
brilliant.
you will be surprised. These kind of support groups do exist, and so you don't really need to worry. See, all these things as a person you think about. My old man or old lady has got this particular problem.
Yeah.
Finally, you can do something on a precautionary ways. Ensure that your family, complete family, is completely insured for medical. This is excellent. Today, a policy of less than 20 lakhs is not going to be of a great help to you. Cancer is a chronic kind of a disease. It can actually demand a lot apart from your personal involvement, a lot of financial involvement. And if you take that particular element out of the picture, it does cost. Insurance does cost, but it doesn't cost so much that your wife's savings, absolutely.
You're not going to be using dipping into your savings. I mean, you're having somebody else take care of that.
Savings can really get wiped out.
Yes. Pearls of wisdom that we have from Dr. Deshpande today. It's so heartening to know that we have support system in terms of even logistical support that patients might require. And in fact, even a group like this Sipping Thoughts, it's a group of women who are continuously taking decisions for their family, and for them to know all of these, and the support that we have from the country, from the providers, I'm sure it is going to help them make better decisions if at all they are in that situation. And like Sir said, that don't be afraid of any disease. Read about it, get good knowledge, and discuss that with your doctors. We are living in a time where there is a lot of information out there. Go to it, but know how to filter them out and know how to consult your doctor, and I think that that will really help you get through any stressful time. So with that, thank you, Dr. Deshpande,
Thank you,
for
Rashi.
coming and gracing.
Thank you very much.
Yes, and any parting thoughts for our ladies over here, for sipping thoughts, and how they can take better decisions for their family in terms of healthcare?
Well, I'm sure they have bestowed you that much of intelligence. So wish you all the best and take good care of yourself. Thank you.
Thank you.